Cervical cancer is a kind of cancer that affects the cervix, which is the lower portion of the uterus that joins the vagina. Abnormal cells in the cervix have the potential to develop into cancer. They could increase and invade the cervix and the adjacent tissues if not removed. Join me in this podcast episode as we explore the intricacies of cervical cancer, delving into its stages, symptoms, and the crucial significance of awareness and prevention. I am Dr. Agnes, and welcome to Talk with Dr. Agnes. What are the symptoms and signs of cervical cancer? Cervical cancer typically shows no signs in the early stages. Symptoms may start to show once the precancerous cells have developed into cancer and have begun to spread deeper into the cervix or other pelvic organs. In the later stages of the disease, common symptoms for women with cervical cancer include 1. Vaginal discharge. 2 is unusual bleeding in the vagina. 3 is vaginal odor. Consult your physician if you experience any of these symptoms, as they could indicate cancer or health issues. Now, there are 4 stages of cervical cancer. Stage 0 is carcinoma in situ, a collection of abnormal cells discovered in the body at the site of initial formation. Stage 1 indicates that the cervix contains malignant cells. Stage 2 indicates that the tissue surrounding the uterus or the upper 2/3 of the vagina has been affected by the malignant cells. Stage 3 appears when the disease progresses to the kidneys, pelvic wall, lower portion of the vagina, or both. Stage 4 is when the cancer spreads to the bladder, rectum, and surrounding areas. Now, what are the risk factors and causes? Human papillomavirus (HPV) is the leading cause of cervical cancer. It is directly linked to over 95% of instances, especially high-risk kinds like 16 and 18, which are mainly spread through sexual contact. Compared to other ethnic groups, Black women are notably more likely to experience morbidity and mortality from cervical cancer. Risks of cervical cancer include 1. Smoking. The risk of cervical cancer is increased in women who smoke. Number 2 is weakened immune systems. Since the body may find it difficult to successfully fight against HPV infections, diseases like HIV that weaken the immune system increase the risk of cervical cancer. Number 3 is family history. A person's risk is increased if there's a history of cervical cancer in their family. Number 4 is chlamydia infections. Bacterial infections spread through sexual contact can increase the risk as well. 5 is diet. A diet lacking in fruits and vegetables as well as obesity may increase the risk. Number 6 is diethylstilbestrol, DES. Pregnancy-related exposure to DES increases the risk of cervical cancer in offspring. Number 7 is socioeconomic status. Regular screening may be hampered by limited access to healthcare or barriers as well to healthcare, which raises the risk. In terms of diagnosis, screening tests, colposcopy, biopsy, and staging procedures are all part of the diagnosis process. It is imperative to promptly follow up on aberrant results, particularly for Black women who can face delays in HPV clearance. Cervical cancer screening preparation includes 1. Menstrual period. Avoid taking tests during your menstrual cycle. Number 2 is douching. 2 days before the test, refrain from douching. Number 3 is sexual activity. 2 days before the test, avoid engaging in any sexual activity. Number 4 is tampons and vaginal products. For 2 days before the test, refrain from using tampons, birth control foams, jellies, or other vaginal creams or medication. In Nova Scotia, a mandatory test is recommended for sexually active women starting at the age of 25, with testing frequency determined by test results as part of the cervical cancer screening program. If screening has a track record of negative results, it might end at the age of 70. To effectively combat cervical cancer, continuous efforts must include raising public awareness, conducting timely screening, and removing barriers that particular demographic groups encounter. Now, there are several ways to reduce the risk of cervical cancer, such as 1, regularly using latex condom during sexual activity. 2 is deciding against smoking. 3 is undergoing routine pap testing to detect cancer early. Number 4 is delaying having sex at a young age. Number 5 is limiting the number of partners for sex. Number 6 is immunization against HPV. Number 7, PAP and HPV testing regularly. Obtaining follow-up care for any abnormal tests result is imperative. Black women are more likely than white women to report pap smears, but are less likely to follow up for abnormal results. Make sure to schedule and maintain your follow-up sessions as soon as possible, because black women require more time to recover from HPV fully. If follow-ups are neglected, cancer may grow and spread, necessitating more invasive treatment and perhaps worse health results. In summary, prevention is an effective tool in the fight against cervical cancer. A strong defense is formed by implementing strategies including routine screening, quitting smoking, safe sexual behavior, and HPV immunization. I hope today's discussion has been both enlightening and engaging. Your thoughts and insights are highly valued, so please take a moment to share your feedback in the comment section below. Stay connected with Talk with Dr. Agnes on our diverse social media platforms for updates and content, while subscribing to my YouTube channel. By doing so, you will make sure that you receive timely notifications whenever new content is released. Now, if you found this information helpful or beneficial, please feel free to share it with someone you care about, as together we can spread knowledge and promote better health. Now, do not hesitate to contact me at talkwithdragnes@gmail.com and via my website talkwithagnes.com. If you have any questions about my web series or potential partnership with themes for health and promotion. Now, until our paths cross again, keep striving to become your best and healthiest version, and I'll see you soon.